Hi, welcome back to our channel. You can have the best plan figured out for the way you want things to go, but sometimes life throws you a curveball, and that's what I want to talk about today. I'm having surgery in 4 days, and I'm having a parathyroidectomy because I have hyperparathyroidism. And I found out a couple months ago that I have an adenoma in my lower parathyroid. My throat has been sore a lot by the past few years, and then I was starting to have weird pain like on this side. So my doctor ordered a CT scan, and they seen something on the scan on this side. So they wanted me to have an MRI, which I had, and then they determined that that was an adenoma on my parathyroid. So then they did some tests, and my parathyroid hormone, the PTH, was really high. I believe it was like 130. And then my calcium in my urine, I did a urine test, and that was high. And I was already diagnosed with osteopenia 2 years ago, and then they redid the bone density test, and they said that the osteopenia got worse and that my hip was actually considered osteoporosis. And what the hormone does in your body, it regulates the calcium in your body, and if you don't have enough calcium, this is my understanding, I might be off a little bit, but that it'll pull the calcium from your bones, and that's why you get osteoporosis. Right, Clark? And I had seen a surgeon then about it, and they determined it was hyperparathyroidism, and really the only cure for it is surgery. And the way they do it is, while you're under, they're going to remove the one with the adenoma on it, and then they take blood and they test it, the PTH, that hormone, and if it came down, then they know that they got the right one, and then they'll sew you back up. They'll sew you back up, and then you're done. But if the hormone stays high, they have to go exploring, because you have most people have 4 parathyroids, and they all sit underneath your thyroid gland. Sometimes they're not under your thyroid. They could be in your chest. They could be other places. So they'll do an exploration and look for the next one and remove that one, and then test your blood. And if it comes down, then they're done. If not, they have to explore. They'll take out at the most 3.5. They leave a half of one in there. I'm not really sure what happens if it never comes down. What happens after that, I'm not sure. So yeah, I've had a lot of symptoms, and now looking back at them, I never thought I didn't know what they were from, but now looking at what hyperparathyroidism can cause, I'm thinking some of these things I've had is related to this. The symptoms of fatigue, constipation, dry eyes, insomnia, stomach issues, headaches, heart palpitations. Another symptom that HPT causes is brain fog. And I've actually experienced that, and I do occasionally experience it when I was working, as I work from home, and my job is a very thinking job. It's where you have to think logically and problem solve, and I just had brain fog. I just couldn't think right, So that is one of the symptoms. Okay, so I just wanted to document this to maybe help other people on their journey, because I didn't know anything about hyperparathyroidism. I didn't even know parathyroids existed. I tried not to show it to Mike, that I am nervous about Thursday. And it's weird. I guess the thing I'm most nervous about is being intubated, because I have never been intubated. I never had surgery. I've had procedures, but not like, I had a colonoscopy, I had an EGD. I never had surgery, and I've never been intubated. I want to have this done so the osteoporosis doesn't keep getting worse and get better. You know, I think it can get better, but it'll have to be monitored. You know, the calcium level, my calcium levels will have to be monitored, and the hormones and all that. But I'm hoping for a good. I'm thinking positive, right, Clark? Because he's gonna be there helping me recover, right? Yeah, yeah, I know. You're a good boy. Helping me recover. All right, so we will see you at the hospital.